Hi students, welcome to HSC Biology and Module 7, Infectious Disease. This is video number 19. We're going to be looking at public health campaigns. So this continues our series of looking at procedures that can be used to prevent the spread of diseases, and this time we're going to be focusing on public health campaigns. So as usual, we want you to understand what public health campaigns are, their specific purpose, and perhaps to be able to evaluate one or more current campaigns that are being used by government departments to help raise awareness of particularly an infectious disease or an approach designed to minimize the spread of that disease. The Nelson textbook focuses in on responding to infectious disease using an acronym RICE. And I quite like the way that they've done this, and so I've just taken those key ideas, reproduce them in this little infographic for you. So whenever we're trying to deal with the spread of an infectious disease, particularly something new, and of course the example we keep going back to is the one that we've all recently lived through and are currently still dealing with, and that's COVID, caused by a virus, so an infectious pathogen. So therefore what we needed, first of all, was some sort of resolution, was some sort of government action. Now this can occur at a multi-government level like the World Health Organization. It can be a specific deliberation from our own national or state governments to have some sort of specific plan in place to say this is actually unusual and we need something specific in place. What we then want to do is we want to talk to science. Now, of course, we can always go to Facebook or social media generally, or Google, and find our information there. But really, if we're going to have effective solutions, we need to go and we need to collect the science. So this is about data. This is about specific data relating to the incidence of disease, which is called epidemiology. We've already looked at epidemics, and it's the same root for that word, epidemiology. Studies that are related to the incidence of particular diseases, maybe give us data about the ages most susceptible, or about the particular demographics that might be associated with higher incidence of a particular disease. It may be as simple as using Koch's postulates to identify the cause of a particular disease. And of course, that's a really important step in moving forward into treatments and prevention. Then we need a coordinated response. And we've already talked about the fact that we can have local, we can have regional, and we can have global responses, all different types of responses, from guidelines about sneezing into your sleeve, not shaking hands, washing your hands on a regular basis, sanitizing surfaces, to closing down schools, to closing down airports and minimizing immigration and emigration. And so all sorts of actions can occur at a number of different levels, both within the home and, of course, across country and international boundaries. And one very important level that we also need to talk about is education. And this is where public health campaigns really fit. And there's been a number of public health campaigns, and there's always public health campaigns, I should identify. And they're not just about infectious disease, they're about all sorts of aspects of good health. And we're going to investigate a few of those. This is our focus for this particular video, in this video. So the Australian Government Department of Health is an organisation that's really responsible for public health in our country. And they provide a number of different, they provide a very comprehensive website with lots and lots of information, and well worth us having a look at that, which we'll do in class. But some of the current campaigns, so I've just taken this very recently to, so we're talking April 2021 when you're watching this, to look at some of the campaigns that are currently on the Department of Health website. So you can see smoking still remains as a public health campaign. So does drug help, so does healthy produce, so do Girls Make You Move, and immunisation. Now, there are others as well. The HPV virus immunisation program is also one of the ones that I noticed on the Department of Health's website. And they are continuing to look at ways to try and get the message of health, including things like immunisation, out into the public knowledge. Education in this case is very, very important. There's a lot of misinformation associated with things like immunisation programs. And so it's very important that the facts are presented. Now, like anything, if you're going to do good science, you want to make sure that you get your information from reliable sources. Government departments may be regarded as one of those reliable sources, but we also don't want to get our information from just one source either. As good scientists, we always want to make sure that we look at multiple sources. We look at making sure that the information that we're reading or seeing or hearing is consistent, that the message is consistent, and that perhaps any of the issues that maybe may counter that message, that maybe don't support that message, are still presented in a way, or are still able to be determined in a way that helps you to make informed decisions. That being the case, the Australian Department of Health are obviously interested in trying to raise awareness about things like immunisation, about trying to encourage good eating habits, minimising the risks of substance abuse. So they are going to have an agenda. They do have an agenda, and they will be trying to put these messages out there in such a way that is perhaps discouraging certain behaviours and encouraging others. If you're aware of that, when you go and have a look at each of these, try and keep an open mind as you're watching each of these particular things. And if there's anything that doesn't make sense or anything that seems to conflict with your views, then they're the things that are worth looking at in more detail. But again, what we're interested in is the science associated with each of these particular areas. We're not just interested in people's opinions. Everybody has opinions. And what we want to do is we want to make sure that the opinions that we're getting are based on data and based on good science. What are some of the other things that the public health departments are trying to do? Well, they are responsible for the development of policies and regulations around things like good hygiene. So we've already talked about the fact that there are hygiene practices that relate to the medical field, that also relate to food handling, food supply, food development, food service. So there's a lot of areas where there are government policies in place that mandate certain activities, certain requirements, certain practices that are associated with each of those. There are also a number of reportable diseases. Poor little fella at the back of this has whooping cough, and it's one of the diseases that is on the mandatory reporting or notification list. So if you have a child that you suspect is suffering from this, you take them to the doctor will report the incidence of this particular disease. And that helps us to get in front of things very quickly, because what we're interested in is rapid response. We want to know if there is a particular pathogen that can cause one of these serious diseases in the population. We need to know how to respond quickly to that outbreak, how to contain it, how to raise awareness of other families in the region, and to be able to ensure that those cases are isolated cases and they don't spread rapidly throughout the population. As another kind of side area to this look at public health, there are some serious consequences potentially following disasters. Now, in Australia, we've been pretty well protected from a lot of tectonic events, volcanic eruptions, earthquakes, but we do have them occasionally. But what we also have are cyclones. And cyclones, twisters, hurricanes, also occur in other areas around the world. And sometimes when these hit, they cause major damage, not just to properties and potential loss of life, but what they can also do is they can damage things like the water treatment systems. And if that happens, then there can, or that can stimulate an outbreak. And so therefore governments that are involved, they may be at local government level, they may be national governments getting involved, have to act very quickly in order to try and address the losses of potential property and life, but also to be able to ensure that those that are still survivors that are trying to sort of get their own lives back in order are not then subjected to further incidents of particular infectious disease outbreaks as a result of perhaps not having access to clean drinking water, perhaps having sewage systems that are not working as they were before, and so on. So disasters are hopefully going to be a fairly irregular occurrence, but again, there's something that public health often need to respond to in order to ensure the safety of the population. We will have a look at a specific case study. I think some of the stuff that followed Hurricane Matthew in Haiti was a really interesting case study for exactly what I've just talked about. And I think it's also worth you having a look at a couple of these current public health campaigns and just getting a sense of what they're trying to do and how convinced you might be by these campaigns. Thanks for watching.